judges. Our one and only, the finest gentleman on campus with the Faculty of Health and Allied Sciences, a lecturer, Mr. Pa Kofi Tewia Edu Jemfi. Say hello to your audience. Alright, so it's from his own mouth. Call somebody, call a friend to tune in to PENTVARS Radio 96.1 as we listen to today's show. As always, the program has two sections. We have Street Health and then we do the main studio discussion. Street Health, where the Street Health team goes out into the field, your homes, your hostels, and they interview people on the topics we are going to discuss for that week. Street Health this week was fun. The Street Health team went out and spoke to people, asked people questions on drug interactions. Let's go and quickly listen to what people had to say out there on drug reactions, and we'll come into the studio to confirm or disabuse what people said. All right, take it away.
You lock down on PENTHEALTH. On PENTHEALTH.
I've been taking drug.
Yeah, I think one is maybe when the person is not feeling well, they took drug to regain their strength.
Can you give us some of the drugs that they've been taking?
Maybe painkillers. For example, para, Jibidol.
Michael. Alright, Brother Michael, hope you are doing well.
Oh, yes.
Alright. Have you taken any drug before?
Yes.
Okay. So, after taking the para, what happened to your body?
Just remove pain.
Oh, okay. So, meaning you were in pain and you took the para and the para removed the pain?
Yes.
Oh, okay. Can you tell us what happened? Like, how do you know that the para has removed the pain?
I have a feel anything, so you just remove pain.
Okay. So, after taking it now, you don't feel anything?
I have a feel anything.
Okay. Alright. Thank you.
Have a high effect when you take these drugs before the meal. And then these drugs can also cause some of these side effects that the drugs cause is just dizziness. Then you can also
the food, or after you taking the drug, the food can you see the drug has a time limit of working in the body. So if you take drug before and after you eat, the food can alter the drugs work in you. In you. So maybe the drug has to work in this way. The food, because you see, food are made up of some certain chemicals and substances. They can also alter the drugs work. So it will be in a way that you taking the drug, but after you not see any change in your health.
Okay.
So I think that one we take drug after meal, and even after the meal, they give us a time. Like they said, 30 minutes time before you have to take something. But before meals in there, we do, but I think it's not right in medicine. Thank you.
Okay, but have you ever taken a drug that at the end of it you felt more uncomfortable?
Yes, malaria drug. When you take it, you feel weaker, but then later you'll be okay. And then some contraceptives. When you take it, it makes you feel uncomfortable and very uneasy.
There was this time that I was having certain headache that I just took a drug in order for me to be okay, but I realized that the drug I took was causing a different problem. Even though I took the drug for headache so that I would be okay, it led to stomach upsets and other things. Yeah, that was the experience I had. So I realized that the drug wasn't good for me, so I stopped taking that particular drug.
Oh, okay. Did you take it before meal or you took it after meal?
No, I took it as prescribed. Yeah, so it was after meal.
Okay. Okay.
I was being told is that when we taking drugs before and after meal, it makes the drug work either ineffective or effective. That's what I know about that. So, for instance, if you taking a drug before meal, it makes it's it slows down the rate at which it could work. That's what I know about that.
So what if you take it after meal?
After meal depends. It can also either increase the rate at which it work or reduce it. And also one thing I also know is that for some it reduces the side effect. If you take in a particular food, you may either feel dizzy or something, but if you take in the food, it may either reduce the side effect so that the drug can be able to work properly.
Okay. So meaning it's true that the drugs that we've been taking, some have side effects?
Yeah, some do have side effects.
Okay.
Like nausea and vomiting. That's what I know. And even dizziness, yes.
Okay. So you can take a drug and vomit?
Yeah, you can take a drug and vomit. You can.
You lock down on PENTHEALTH on PENTVARS Radio 96.1 FM. PENTHEALTH, your health and necessity. You lock down on PENTHEALTH on PENTVARS Radio 96.1 FM. PENTHEALTH, your health and necessity.
All right. Welcome back into the studios. That was a section Street Health. We had wonderful comments there. Our pharmacologist has been laughing at Sam, nodding his head at Sam, shaking his head at Sam. Sam said drugs are concussions. Sam said when you take food, according to medicine, it's not right in medicine. It's not right in medicine. Emphatic statement. It's not right in medicine to take to take a drug with food or before.
There are some drugs you're supposed to take it with meal.
So there is that thing. Some drugs are supposed to be.
You're taking with meal.
Okay.
Especially sometimes like meal that contain a little oil. It helps in the absorption of certain drugs.
Okay.
Some drugs are supposed to be taken on an empty stomach.
Okay.
It aids in absorption. Some drugs can be taken 1 hour before meal or after meal.
Okay.
So it depends on how the drug has been formulated.
Okay.
You don't have a strict rule that drugs should be taken after meal. No.
Or before.
There's some drug, when you take it with meal, it delays absorption of the drug.
Okay.
What we call bioavailability in pharmacology. The amount of the drug that will get to the site to work will reduce when you take some drug with meal.
Okay.
And, or some parts of Africa that we mostly don't use cocaine. Cocaine can be used as a pain killer. Okay. Reducing pain. Okay. And cocaine can also be used to treat depression. Okay. But yes, that cocaine has this addictive nature or effect, so we seldomly use cocaine. But cocaine has other medicinal properties and they are used elsewhere to treat pain and depression and all that. Having to realize those who take cocaine are always hyper, always active. Yes. When we say it as any chemical, when taken into the body, has the ability to influence our bodily function. Any chemical. Any chemical. Any chemical. That's the definition for a drug. Any chemical. So by this definition, DDT can be determined as a drug, insecticides and all that. So because drugs are any chemical. But when we come to the health sector, we don't use any chemical in the health sector. Okay. So when we want to fine-tune this to the health sector, we will define drug as a chemical that when taken in has the ability to alter the body function. And we use drug to cure, treat or prevent diseases. Okay. So drugs should serve as these three purposes in the hospital.
In the healthcare setting.
Yes. To cure, to treat and to prevent diseases.
All right.
Curing means you have the disease and we are giving you the drug to take it off. So we are curing it. We are curing malaria. There are some diseases we can't cure, we can treat or manage, such as when you have hypertension, diabetes. We give you drugs to manage them. So we can use drugs to either cure a disease, to manage or to prevent. Okay. Preventing means you don't have the disease, but you anticipate that you might get it. So let's give you a drug that will prevent you from getting the disease in the near future. That's why we do vaccinations. So the vaccinations that we do They are prophylactic treatments.
Okay.
Yes. So those are
so
maybe
these are what this is what a drug is. A chemical.
A chemical
used
that are used to either cure, treat, or
prevent diseases to persons or to man. Okay. So if someone takes a drug, generally, what is a drug supposed to do? The
mechanism.
Yes.
Okay. Generally, when you take in a drug, and before I go on, there's something that I want to say before probably we can go on with this discussion. Before you take in a drug, there are two things that your body must have. Your body must be strong enough to resist the drug itself, not resist how to stop the drug from working, but stand firm to the drug, because the drug, aside the drug going to cure you of your disease, the drug also have some effect that it can bring on you. If your system is that weak, that effect can overpower you. So to undergo a treatment, you have to be very healthy, because apart from your sickness, you have to withstand the medicine, because you have to withstand the effects of the medicine. That some people, they take drug and they become so weak and all that. Will come to that. Then another thing, first, do no harm. There are times it is possible that maybe when you are not well, you can choose not to take drug. You can get better by taking drug or without taking drug. So first, do no harm. It is a good remedy sometimes to use nothing. This was said by Hippocrates. He said it's a good thing to sometimes not use anything.
If you feel sick
and you think that probably this sickness you can withstand it. As I said, taking medicine can cure you of the illness, or someone will be sick, will be taking medicine and still die. So taking medicine can either cure you of the disease or it can't do anything to you. So that one too is there. And patient may recover in spite of maybe taking any medicine. Patient can recover either by taking medicine or by not taking medicine. These are the things that you should take note. Why am I saying this? All drugs are dangerous poisons.
All drugs?
Yes, all medicines, all things, they are dangerous poisons. The dosage determines which one will be harmless or harmful. When we say dangerous, what I mean is when you take something sufficiently in high dosages, something bad can happen to you. So when it comes to drugs, we have to pay attention mostly to the dosage or the dosing frequencies of the drug. That's why
when you say dosage, you mean the amount?
The amount, the quantity that you're supposed to take. If let's say you're supposed to take maybe 1 gram of para, and you decide to go and take maybe 4 grams of the para, it can have some effect that you don't like. You get it? Some people can even have liver failure from doing all that. So when it comes to drugs, we should be careful with the dosing or the dosages. So all things are poisonous. The dosage determines whether a thing will be good to you, harmless, or what? Harmful. Will that be okay?
Yeah.
Then let's go back to the question that you asked. When you take a drug, what happens? Drugs don't just work magic. Drugs sometimes emulate what our system do. Let me say this in a very simple way. It will bind to that particular sensor in your body and causes your heart rate to go up. Are you okay?
Yeah.
So when someone comes to the hospital and the person sometimes having a low blood pressure, their BP has gone down, their heart rate has gone down, there are times in the hospital they give adrenaline. What adrenaline is going to do is it's going to put that sensor on to what? Increase your heart rate. Are you okay? So once your heart rate goes up, then it's becoming normal. But what happens when adrenaline keeps stimulating that sensor? What is going to happen? Your heart rate will keep going up. So any drug that can cause your heart rate to go up can further increase it. Are you okay? And that means you are going to have something we call in medicine tachycardia, increasing what? Heart rate. Your heart rate has gone up. So then we can say that one side effect of a drug that will increase your heart rate, like cause your heart rate to go up, is what? Tachycardia. But in as much as the drug is stimulating your heart to beat faster, then it means it can go beyond the normal what limit. Are you okay?
Yes.
So that is for that aspect. Then let's say, what if your heart rate is already up? Your heart rate is already up. Now we have to give you a drug that will come in and reduce your heart rate. And we said adrenaline will put a sensor on.
Yes.
Adrenaline comes in.
Puts a sensor on
A certain receptor or a sensor. So the drug will go and put that sensor off. And prevent adrenaline from putting it on. Are you okay? So we say that adrenaline will come, increase your heart rate in this manner. We give you a drug, the drug will go, prevent adrenaline from putting the sensor on. So in that regard, adrenaline can stimulate your heart rate to go up. And as long as the sensor is put off, your heart rate go down. And any drug that can slow your heart rate can slow it down further. So then people who take drug that slows their heart rate will also complain of getting what we call bradycardia. Bradycardia means slow heart rate. That means the drug has slow effects. Bad effect, the unwanted effect. Maybe you took the drug because your head was aching, but all of a sudden you feel dizzy, you feel nauseous. Those are side effects or the unwanted effects of the drug. So please, are we okay?
Yeah.
So listeners, we have two major effects: therapeutic effect, the desired result that you're looking for, and adverse effect, the unwanted effect of the drug. So these are the two major.
Is there any time I'm just thinking, is there any time someone can take a drug and not get the therapeutic effect but rather suffer the unwanted effect?
I haven't come across that, but in science everything is possible. But one thing that we should also take note is that most of the time the side effects are indications that the drug is working. Sometimes the side effects, not all the time, I said sometimes the side effects are indications that the drug is working. Let's take the example that I said. Your heart rate is down. We give you a drug to increase your heart rate. Now your heart rate has gone further up. Is it not showing that the drug is really working? Yes. Your heart rate was already up. We gave you a drug and the drug has reduced your heart rate and has gone down further. That means the drug is working. So sometimes the side effect of most of the drug really shows that the drug is working. I'm not saying that all the time, but most of the time, with regards to the system that the drug is targeting, it can really show that the drug is really working. Especially when you took a drug because you have issue with blood clotting. After your blood doesn't clot well, so we give you a drug that thins your blood, or that can help your blood flow freely and all that. When you get a cut, because you have taken a drug that prevents clotting, you can bleed profusely. And that can show that the drug is what's really working. Because you took blood thinner drug that will prevent your blood from clotting. So if you're bleeding profusely, that means that the drug is really working.
It's making sense. It's working.
So sometimes the side effect of drug means
that the drug is working.
Yes.
all right. So with these adverse effects, side effects, unwanted effects, are there groups? Are there types of them?
Yes, there are types of adverse drug reaction. For now, we have 5 major types of adverse
there are 5
major types. Even though now they've added one type, but the 5 major ones that are in most pharmacology books are what we're going to mention. We have type A. Type A form of adverse drug reaction. Type A. Some books will use augmented type A. With the type A,
that's the meaning of the A.
Yes,
augmented.
Type A augmented reaction. With the type A, as I said, let's assume like you took a drug that will slow your heart rate. When you take that drug can further reduce your heart rate. So you get what we call bradycardia. So the type A, the adverse effect is known from the main use of the drug. I don't know whether I'm making sense. The adverse effects can be predicted. Let me use the word predicted. Because if a drug is going to slow your heart rate, then you can get that, no, this drug that I'm taking that is going to slow my heart rate can further bring it down. So you can predict the side effects from the actual pharmacology of the drug or the actual use of the drug. Are you okay? You are taking a drug to help you urinate. One side effect means you can urinate and become dehydrated. So from that drug, we can predict that when you take this drug, this could be the side effects. So it's predicted.
Okay.
So we can predict.
Okay. I guess those ones are what are written on the labels of the
labels of the drug. So when you buy any drug and take the leaflet out, we have side effects. The predicted side effects. So you can have this, that. They are predictable. And sometimes when someone is having some effect with this, we can either correct it by either reducing the dosage or changing the person from the drug to a different side effect to the drug. As I said, the type A, we can predict that maybe by taking this drug, this can happen. But with the type B, maybe after they did their studies, animal studies, clinical trials, no one recorded that bizarre reaction or that, let's say, allergic reaction. So we mostly say people who respond negatively to some drug what we call the experience, what we call a type B form of adverse drug reaction. We also call it the bizarre reaction. And with that reaction, we can't predict. Like someone taking a vaccine, and all of a sudden the person is saying that I have blood oozing from my eyes and all that. It is not a predictable reaction from you taking vaccine. When you all take the vaccine, we all know that maybe there can be pain at the site, your body temperature can go up, there can be swelling and all that. These are known reactions to what? Vaccines, some vaccines. Because as long as we are introducing a foreign material into your body will what? Respond to it. So immune reaction, you get headache, your body temperature can go up and all that. That one is there. But all of a sudden, you have your eyes coming out. It's not predicted. Your eyes are about to remove. Yes. So we mostly say that type B form of adverse reaction are unpredicted. And they are host dependent. Yeah, I was going to ask that. Are they specific to people? Yeah, they are specific to people. There are people they are allergic to sulfur drugs or anything that sulfur is found in. So with that person, maybe when they go to the hospital, they can ask, are you allergic to sulfur? Are you allergic to this? When they know what your body doesn't like, they wouldn't give it to you. Yeah, because not everyone is allergic to sulfur. I just had a situation where someone took some anti-malaria drug and the person had Stevens-Johnson syndrome. Like allergic reaction from head to toe, it became very dark. It's like the body even peeling off and all that. So we asked, which drug? Then we found out that she took some drug that contains quinine also, and the body doesn't like it. So in this person, initially, no one knew. But now that she has taken the drug and the person is having that reaction, then it has to be recorded. So when the person goes to any hospital, the person can say, oh, I am allergic to A, B, C, and D. Because that form of reaction has not been recorded among maybe study groups. So they are host dependent. The person taking it will respond in some way. So it means that the people should be sending their data, telling the health professionals. When you take any drug and you experience some reaction, you can walk into any hospital. They have some yellow card. You can fill. They will ask you when you took the drug, whether you have been taking the drug with other drugs and all that. They will take your full details and they will forward all those details to FDA. And FDA will take appropriate measures. Because I remember, I don't know whether I should keep this in before we go on, about something that led to the establishment of FDA. Please do. In the early 1950s, there was a disaster we called a thalidomide disaster. People who were pregnant took a drug we call thalidomide, and after they gave birth, most of their children had their limbs off. A situation called ficomelia. Most of their limbs were off and all that, and they have to trace the drug, the defect to, because they realized that any pregnant woman who came to the hospital and were given that drug had their children having those birth defects. So then FDA tighten their groups out that before a drug will come out, we have to really do a lot of checks before drug comes out. And there was an incident that one to contain sulfur. There was a drug that were given to pregnant women to treat what we call morning sickness. You know that when people get pregnant at a point in time, they vomit and all that. So these drugs were given to treat emesis. Emesis means vomiting. And it killed over 100 people after they took the medication. And some also had birth defect and all that. So now FDA or there was this establishment of FDA that also said before a drug will come out, then the drug should go through a thorough check or thorough testing regulation before the drug is finally out. So in Ghana, if people maybe complain of having side effects to a specific drug, the FDA can call the drug out because they will now know that their drug is not helping the people of Ghana, because people are responding negatively to the drug. So the drug can be called out and not be used again.
So I'm wondering, so are people reporting?
Yes, people do report. Recent studies shows, even though the rate at which they report isn't that much, yes, it's very low. So we should sensitize people that when they take drug and they have any form of adverse reaction or side effect or any unwanted effect that is not that good, they can report to.
So just go to a health facility.
I think FDA should even have their contact numbers all over. You can call FDA directly if someone answers. You tell them the type of reaction that you experience. Maybe I took a drug and after this number of days I started having this reactions and all that. So they will take all those details, take the drug. They can even ask questions whether you took the drug in addition to other drugs and all that, so that they can get information on drug reaction to enable them set up.
I think this should be pushed. This sensitization should be pushed,
especially on adverse drug reactions. That's what we call pharmacovigilance. Pharmacovigilance means monitoring the effect of drug. So maybe you taking the drug, you can monitor for the therapeutic effect and the side effect. So if you realize that this drug that I took is making me feel some way, or I'm having some form of effect that isn't that good, you can go ahead and report. But if the side effect is with the known one, that one we can just manage it. Maybe you took a drug and your heart rate has gone so low, we can either switch you from one agent to the other. But when you take a drug and getting this allergic reaction all over, that is very serious. People get their hairs off your form. They turn into a different human being altogether.
Okay, this is wonderful. I think this sensitization has to be pushed. Okay, so we are type A, type B.
So type A is augmented, as I said. Type B is bizarre, or as I said, it's host dependent, or what in medicine we call that most people will get what we call anaphylaxis. Anaphylactic shock, allergic reaction, and sometimes you wouldn't know who will get that allergic reaction. That's why I said it is what host dependent. As I said, someone will take para, two people will take para, one will get some bizarre reaction, another person will not get bizarre. So we can't say that para is causing, but probably something within the person is responding negatively to the para. So we have that. Then we have type C, from prolonged exposure of the, or we call it the chronic use of the drug. You'll be taking drug chronically, maybe paracetamol. If you take para and you abuse para over a long period of time, it can get what we call hepatotoxicity. The end product of the para can be so toxic to your liver. So if you like chewing para, every now and then you are chewing para, going beyond even the recommended dosages. When you use the para over a prolonged period of time, you can get that form of what effect. Or when you take this NSAIDs, we all know NSAIDs. NSAIDs, sometimes when I'm talking, I think I'm talking to medical and nursing students. When you talk of NSAIDs are medicines that we use to cure maybe pain and aches. Example of NSAID, diclofenac. When you take Brufen, when you take diclo, Gibidol, those things. When you take it for a very prolonged period of time, it can have effect on your kidneys. So we have something we call analgesic neuropathy. It can have some consequence on your kidney. So prolonged exposure to some medications can cause you to have some form of effects. Are you okay? So that is it. Then we have the type D. Type D. With the type D, they mostly call it delayed or accumulation. Let's say you stay under a high tension pole, or let's say you live in an area where there is maybe transmission of radiations, or those who even work in facilities where they are almost in contact with these radiotherapies and all that. You might be exposed to this radiation. You will not have the experience at that moment. You get it? But after some years, you start having effect. And they can link it to the radiation that probably are getting some cancers and all that, and can be linked to you being exposed to certain radiation. You didn't get the reactions immediately, but it stayed in you for some time. Another example could be what I said. After the woman took those medications, after 9 months they gave birth and they found the effect on the babies. It's delayed.
Okay.
You will not see it immediately, but you will get the consequence maybe after some time. So that is the delay.
Okay.
Then we have the last one, end of use. End of use, type E, end of use. We have type F and all that. We have type E, end of use. So with the end of use, people start reacting in some way when we stop them from taking certain medicines. That's where the withdrawal symptoms or syndrome comes in. Let's say someone who has been taking alcohol. If you want to, terminate or stop the person from taking alcohol, we just don't stop it abruptly, because the body has adapted to certain environments. Do you get it? Maybe the body has adapted to having certain concentration of alcohol in the body. That means the body to function normally. But because now the person isn't taking in those maybe chemicals again, the body is reacting negatively. So the person feels, let me use the word, I don't want to use the word abnormal. They start behaving in a certain manner that we don't want. But immediately they get some of those things into their system, they get okay. So maybe to prolonged use of drug can, maybe after using the drug for a very prolonged period, when we are terminating its activity, it can lead to what is
so that's the end of use.
End of use, maybe reaction, because you are no longer using it again. You tend to have certain withdrawal symptoms. So that is the end of use form of.
Based on the types that you've just explained to us, a question has come in. This is from Kofi. He said he's Kofi. He's asking, so were these, people are still bothered about this. He's asking that, were these checks done?
Yes.
For the vaccines?
This check,
were these checks done for the vaccines? Talking about the testing, the clinical trials,
So let me go back a little. To some of these things. Before a drug comes out, we call something pre-clinical trials and post-clinical trials. At first, we discover the drug and we test it in animals. So if after testing these drugs in animals and all that, we think that we are good to go, then we select some people who have these characteristics. Maybe, let's say a drug has been developed to cure hypertension or treat hypertension. First, we have to test the drug in animals for safety, to determine the dosages and all that.
That's the standard.
Yeah, the standard. So from the animal trials, then we come to the human trials. With the human trials, we select people with the conditions, maybe hypertension, and we give them those drugs to find out whether the drug will be able to reduce their blood pressures and all that. Then from there, we take note of side effects and unwanted effect of the drug. So we do all those things. So we do it clinically. And with that one, we do it in a select few, just a few people. Then after the pre-clinicals, we come to post-clinical trial. That is when the drug is already in the system. So when the drug comes out and the drug is in the system, we have to also still go ahead and monitor for the side effects of the drug.
That's standard. That's
standard way, because after doing the preclinical trials, we selected just a few people and we monitored them. But when the drug comes out, probably someone is taking the drug in addition to other agents and all that. So when the drug comes out, we have to also follow it out and monitor or take information of side effects.
Are this being done?
It should be done.
It should be done.
That's the use of FDA. Because FDA is our pharmacovigilance center. Pharmacovigilance means we're going out to monitor side effects of drugs. Because the drug might have gone through their preclinical trials. And you know, maybe the trial was maybe done in Europe, was done in Asia. And we have different genetic setup and makeup and all that. So when the drug comes out and we are also using it, we need to also go out and be checking on this side effect. That's why maybe if you're a patient taking some medication and you start exhibiting certain unwanted or harmful effect, you should be able to report so that FDA can pick this issue up. With the vaccine, because of the hasty nature of the vaccine, I don't think they had enough time doing the preclinical trials and even some post-clinical trials. So now what we are doing is, now that the drug is out, anyone who takes the vaccine and maybe experience some bizarre form of reaction, the person should report. So that at least with the type of vaccine that the person took, FDA will take notice of some of this reaction, so that in the near future it can be added to the predictable or unpredictable effects of the drug. So that's what I can say about it.
Okay. There's a second question here. The person is asking, how long would I know I'm getting a type C reaction?
How long? Okay, this would
I think the type C was
prolonged.
The prolonged.
Use. It can be from months to years.
Okay. So that's how come the person is asking that question.
Yes,
Okay.
It can be because if you take a drug for a very short period, so after that period you're okay. But someone chronic, so the type C, you say chronic.
Okay.
Chronic means maybe over 6 months, over a year. You know that we have people who are supposed who are being put on a drug forever.
Yeah.
So most of them might have the chronic effect or type of adverse drug reaction. But when you take the drug for maybe a day or two, you can get maybe the predictable and the unpredictable effect. Like a drug like, as I said, brufen and all that. Continuous use of brufen can cause your body to produce a lot of acid that can lead to peptic ulcer. So there are times when people have ulcers, they will tell them not to take brufen, aspirin, diclo. That's because the side effect of the drug will be what? Gastric ulceration. You get it? So if the person keeps taking the drug for a prolonged period, then the side effect will be so much.
Okay. This is from Patricia. Please, thank you for this show. We are really learning a lot. She's asking, please tell Say to talk to us about herbal medicines.
I should talk to you about herbal medicines.
Yes, tell us something about herbal medicines.
Okay. I will start by saying that I am a pharmacologist. I did not study herbal medicine, but I know that medicines are drug and they can be any form of drug. So until she tells me the type of herbal medicine that she wants me to educate them on. Herbal medicines are medicine, but most of the time we don't recommend them blending it with the orthodox medicine. You know that some people, they will take herbal medicine and take orthodox medicine. When all those drugs goes into the body, they can cause some other effect we call the drug interaction. Some of the drug can interact and the effect will be so bizarre. So sometimes we don't recommend taking herbal medicines and orthodox medicines together. Even though herbal medicines are good, so if you are resorting to herbal medicine, take the herbal medicine. If you want to switch from herbal to orthodox, then switch from herbal to orthodox. Not to be combining them together. It can bring a lot of side effects.
And I think there's a practice that is happening. People are taking the orthodox medicines and combining it.
And it's not a good practice. And one thing about the herbal medicine, make sure the medicine has been approved and has gone through the necessary procedures. Because there are some of the herbal medicine, they can tell you fatrema, or maybe take maybe a glass full of the drug and all that. And as I said, drugs are poisons. And if you should take overdose of the drug, it can have effect on your kidneys, sometimes your liver and all that. So even if you're going to take herbal medicine, make sure the herbal medicine has been approved. And the dosage also matters. Because in our setting, they even mostly say that for a drug to be very effective, the drug should be bitter. And I'm trying to find the correlation between a bitter drug and the efficacy of the drug. Drug can work whether the drug is sweet or bitter. It depends on the receptor that they are acting on. So if they're going to take herbal medicines, they should make sure the drug has been approved.
Good. Then I think, let me help. I think people are thinking this question. How will I know this herbal medicine is approved?
Sometimes when you take the drug, I think you'll find FDA approved and all that on the drug. But the most of the unapproved ones are the ones that we mostly prepare in our homes, and maybe because maybe my grandparent taught my mom and my mom taught me, so I also go get some herbs, prepare concoction, then I take. But sometimes we should be mindful of the dosage. As I said, all things are poisons. The dosage does really differentiate whether a drug will be harmless or harmful. Yes, so herbal medicines are good. I am not against herbal medicine, because the Bible even says we should eat all the fruit and use the herb to cure illness. And even the sources of drug, when it comes to drug making, some of the sources are from plants, which are herbs. So like morphine, like weed, like even cocaine, they are all from plants. And we use it to cure diseases. So herbs are good. The dosage matters.
I don't know. I'm sure there should be a site at the FDA that people can just go there and check for approved herbal drugs or something?
I think they should be. Yeah. They should be. I think they have approved medicines on their site. I don't know, but I think they should have list of approved medicines, because from time to time they come out to tell us that this drug has not been approved and they are going to take it from the market. Because FDA should certify and approve the drug. And now, thank God, KUST, they have a school of herbal medicine. That's maybe train doctors in herbal medicine. So herbal medicines are good, but make sure you take it accordingly and not to combine it with any of the orthodox medicines.
We know that some drugs are syrup, liquid.
Yeah.
Some are pills.
Yeah.
Some are capsules. What's that?
Oh, in the formulation, and sometimes the formulation sometimes helps. There are some drugs, if not for the capsules, if you take in the drug would have been destroyed by intestinal enzymes. Some of the drugs too, even for the capsule, they are irritant to our GIT. So the capsule, the one in the capsule,
those ones in the capsule,
serve as a means of helping the drug get to the site of action without it being destroyed by enzymes and all that. The syrup, maybe if you have a child, 2 months, 3 months, the suspension, the child can't chew. So then you will need some
than the pill is now come to dissolve. And
anyone who said that it isn't wrong or far from the truth. Because if you take a tablet for the efficacy of the drug,
so even if the person, because usually the practice here, we go to the pharmacy, we just buy medicine. So at least the pharmacist should do this education for the people.
Yes, the pharmacist or whoever is at the pharmacy should be doing this education. But sometimes they don't have the time. And even how they will even tell you people to even be taking the drug, I always find it amazing. Anapa in my hometown, Anapa starts from 8 to about 10 or 11. So if you tell me Anapa maybe I wake up in the morning, then maybe around 10 or 11, I've taken my first dose. And drug, if you delay and the concentration drops, some antibiotic, if the concentration of antibiotic in the system drops, it's difficult for the drug fighting the bacteria. That's where sometimes you have the bacteria also. The drugs to do with skin, I would advise you to see dermatologists. Those in skin, they can maybe do some tests to find out what is really wrong with the skin. In that when there's heat, she gets all those reaction. Because I don't believe she can be taking drugs for the rest of her life. Maybe something can be done. So she should see a dermatologist. They will do studies or findings to really find out what is wrong. If they get to know the source or the cause of all those things, maybe a medicine can be given to cure it. But because I don't believe she can be taking drugs.
And she's saying she has been taking it for 2 years now.
Yes.
The heat will
the heat is on. So unless probably maybe she designed a system whereby her body can be cooled almost every day. If not, I will advise her to see a dermatologist so that they do some studies and find out what is really causing it. Because when we get to know the root cause, it can be managed. Yes.
All right. Someone is asking, please, what are drug contraindications?
Contraindications. I like this word. Contra. Reasons why you shouldn't take the drug. As I said, we have indications.
That's the reasons why you should take the drug.
Yes. So contraindications, reasons why you shouldn't be taking the drug. So most of the time, the contraindications are written boldly on the leaflet. One of the contraindications will be hypersensitivity. When you are allergic to certain drug. I know that when I take this drug, I get this reaction. So there's no way you venture or go near the drug. So that's one. And the other one too will also be instances, maybe in pregnant women. Pregnant women are not supposed to be taking any medications. Pregnant women are not supposed to be taking any medication. So contraindications are the reasons, and if you know your reason, you don't go near the drug.
And these are sometimes, I think all the time written on the leaflets.
Because if they don't write the contraindications on the drug, and someone takes the drug and starts having some effect, they will sue those pharmaceutical companies. Because why is that? You know that this drug will lead to this, especially the incident that I gave, the thalidomide. Initially, they didn't know. Now people took the drug, and they gave birth, having fecomelias and all that. Now, so when anyone gets pregnant, they don't give the thalidomide to such a person. But they know that anytime they take this drug, it can lead to them having defective children. So they wouldn't dare go near giving those drugs to those patients. So contraindicated are reasons that you shouldn't
take the drug.
Yes, and most of us should know our allergies. Probably you might have taken so many drugs. You know that this drug, anytime I take, I just get this. So you wouldn't even go near it. So those are contraindications.
Wow. So with the 5 types of adverse effects that you spoke about, what should we do if, let's say, we take any drug and we suffer any of these reactions? What should people do?
So this is what we spoke of from the onset. You have to report.
Okay.
Especially sometimes depending, because some of the adverse effects, especially with the type B, the bizarre one, sometimes very serious, and it has to be managed in the hospital. So when that happens, you have to report to the hospital, report the type of drug that you took, any additional medication that you took, and you fill a form. You give all those information on the form. We mostly call the form yellow card. So you fill the form, and that form will be sent to FDA, and FDA can take any measure that they are supposed to take. So as I said, if at a point in time we have a lot of people complaining or experiencing certain reactions, then that drug can be called out.
Okay.
Yes, I can't remember quite recently. Even it's not a drug; it's a food. The milk product, Ideal milk. It happened that certain batch of the Ideal milk had gone bad, and people were, complaining and all that. FDA had to now call those batches of Ideal milk from the market, and Ideal, the Nestle Ghana Limited, also replaced people who bought those products with a new milk. So that should be. The more we report of maybe some side effect or adverse effect to some medication, FDA getting those information will call those medications out so that doctors will not prescribe those medications again.
Okay, all right. There's a question from Elizabeth. She's asking, so can side effects cause death?
Yeah, especially with the bizarre form of reaction. You can get what we call anaphylactic shock. You can go into shock and you die. Yes. Those days, there used to be a drug for treating hypertension, sublingual nifedipine. When you say sublingual nifedipine, drug that you place, sublingual means drug that you place under our tongue. Those drugs were used to treat hypertension, especially when someone comes and the hypertension is so high, they give the drug. But the drug was so efficacious that when you give, it can lower the PP within the shortest possible time. And most of the time, most of the patients go into hypotension, some go into shock and they die. So some side effects of drug can lead to death, especially when you have taken a drug and the drug is lowering your blood volume, or the drug is causing your heart rate to go down. Your heart rate can further reduce until you die. If you have a drug that is causing you to urinate a lot, you can urinate and you become dehydrated. They can die from hypovolemic shock. So side effect can lead to death. Yeah.
So it means that then we have to be careful.
Yes, with drugs. Especially with drugs. I'm very careful when it comes to drugs.
You have to be careful with drugs.
Especially so that you pay attention to the dosages, the indications, the side effect, and almost all those things.
Of them. Yes. All right. Our time is up. Let's see. There are questions here. I will do them. But let me ask this. What is shelf life?
Shelf life
is something we've been seeing on some of the leaflets. What is shelf life?
I'll just, in a nutshell, I don't want to use the expiring date or something, but I just want to find a simple way of going about with it. But most of the time, most of us will mostly say shelf life has to do with the the expiring product or expiring date of most of the drug. That's what most people will understand it
as a shelf life.
Yes, because within after that period, you can't use the drug again.
Okay.
Yes. Okay. And I will tell you that maybe I wouldn't want to use the word shelf life, but I'll tell anybody going out to buy a drug that when you buy a drug, check for the the expiry date of the drug.
Yeah, there was a question here. The person was asking, do drugs expire?
Yes, every drug has an expiry date.
Okay.
And as I said, drugs are chemicals. And if the chemical is going beyond the recommended period, you can just imagine you putting food in your I would just imagine you putting food in your fridge or putting food over there. At times the food goes bad, right?
Yeah.
It means the food has expired. When drugs expire, the chemical becomes more toxic.
Okay.
Yes.
Okay.
So if you don't really know some of the expiry dates of the drugs and you take those expiry or expired drugs, you end up getting some serious side effect that you don't even imagine. Some drugs become very poisonous after they have expired.
Yeah.
And some also do not also act at all after they have expired.
Okay.
So when you are buying a drug, especially take note of the side effects. And I'm begging all of you, I wouldn't want to use the word shelf life, but I'll say side effect. Take name like expiry date. Take note of the expiry date, because you can end up using money to buy poison.
Drugs are dangerous.
Very dangerous. Drugs,
Whether for
drugs
therapeutic,
are dangerous poisons. Anyone listening, drugs are dangerous poisons. The dosage that will determine whether a drug will be harmless or what harmful.
Wow.
And just imagine me telling you that all substances are poisonous, and you are going to take an expired substance.
Yeah.
Just imagine what can happen to you. So we should really pay much attention to those. And I think someone also asked something that maybe they buy a drug and they find USP.
Okay. Yeah, you see it on some of the leaflets. Yes.
USP means United States Pharmacopoeia.
Okay.
United States Pharmacopoeia. We have another. You can find BP. BP doesn't mean blood pressure. British Pharmacopoeia.
Okay.
That's they are a list. It's more like a drug dictionary.
Okay.
Before a drug comes out, maybe Food and Drug Authority, WHO, and all that. We have organizations that meet and they accept the drug. And after the drug has been accepted, it is listed in some of these books. So you find a drug in the book with their side effect, intended purpose, and all that. So when you buy a drug and you find that the drug has USP, it means the drug has been accepted into the United States Pharmacopoeia. Or we have the British Pharmacopoeia. Or we have what we call the national formularies. The drug has been accepted into this agency.
Is that the Ghanaian Pharmacopoeia?
No, mostly we borrow from the BNF. So in Ghana we have BNF, British National Formulary. That's what we mostly use. And most of the drug has been listed over there with their side effects, contraindications, indications, with even their chemical property. So when the drug has been accepted into this pharmacopoeia, then we really know that the drug is really good to be used.
All right. So listeners, this has been PENTHEALTH on PENTVARS Radio 96.1 FM. Our time is up, and we have been with Mr. Pakofi Tewian Jemfi. He has been educating us on drug right now. Say me, I've become very careful.
I always say drugs, you have to be careful, because anything that we introduce into our body sees it to be foreign, and the body wants to react to it. So the drugs, I mostly say, if you are sick and it's not that severe, then you can maybe do some exercise, have some other alternate way that can help you get better. Why not?
Okay.
Yes. The only time I recommend people using drugs is when there is severe pain or there's some infection. You know, when there's infection, your body is unable to fight the infection. Then you need some form of help somewhere. But sometimes with this headache, that time is stress. Me, I realized my source of headache was hunger when I was in class 6. Anytime I come back from school, I'll complain of headache, and my mom will give me food. Immediately I finish eating, the headache disappears. Then I realized that no, not all headaches are caused by disease. Some are caused by hunger.